This presentation will discuss positioning and proning guidance in patients with COVID-19 symptoms. It is assumed that the basic principles of breathlessness management and the accompanying leaflet have already been introduced and/or discussed. This session will explain why it is important for patients presenting with breathlessness and low oxygenation to try and self-manage their symptoms by adopting prone and side-lying positions for as much as 16 to 20 hours a day for the severe to critical patients. It will help advise staff in the ITCs how to help patients and also checklists to perform to ensure patient safety and well-being when proning. The information given is based on guidance that was created and published by the Intensive Care Society based in the UK. A full reference list can be found in the Word document that accompanies this presentation. Patients with moderate symptoms should be advised to lie on their front, so prone, also known as proning, or lie on their side, with changing position every 30 minutes to 2 hours. This change is important as part of the patient's self-management of pressure relief to prevent pressure sores forming. As mentioned, this guidance of altering between lying on their front and their side should have been introduced earlier as part of the breathlessness management along with the accompanying leaflet. It is important, however, to note that these periods of 30 minutes to 2 hours may not be enough to lead to stable and therefore effective recruitment of the lung tissue, and in such cases and circumstances, prone lying a patient, so on their front, should be extended to approximately 16 hours out of a 24-hour period. This will allow for optimal effect and is the reason why it is recommended. The National Guidance for Case Management of COVID-19 suggests a COVID-awake proning protocol as shown in this box. The recommended guidance of WHO clinical management also considers such a protocol. The guidance discussed in the following slide will list the various contraindications for a patient to adopt the prone position. It is important that these contraindications are verified with every patient before suggesting that they use the prone position to help manage their symptoms of breathlessness and try and increase their oxygenation. Practically speaking, if the patient is not sedated or paralyzed, remaining in the prone position or any position for long periods of time will not be comfortable or well tolerated. Therefore, it is advisable to consider rotating positions, including those described in the patient leaflet, such as lying on their side and sitting upright when they are awake, throughout their time in your facility. We will go on to look at and describe the awake proning protocol recommended by the Intensive Care Society in the UK. This guidance will help staff determine when it is safe to prone a patient and when it is beneficial, and when it is not safe nor of benefit to prone a patient. Here you see a copy of the flow diagram decision tool for conscious, i.e. awake proning of patients with COVID-19. The tool starts by determining if a patient is needing supplementary oxygen to achieve a target oxygenation range, usually between 92 to 96%. Be aware that this target saturation range may be reduced to a target range of 88 to 92%, and it will be determined by the clinical coordinator or medical doctor in charge of that patient's case. Please refer to the case management guidance for your specific ITC to know what the target oxygen saturation range is. Following the flowchart, if a patient is not requiring supplementary oxygen, then they can continue to lie in whatever position they find comfortable. This is likely to be lying on their back. If, however, a patient is on supplementary oxygen to help maintain their saturations, it is of value to consider advising them to lie on their front, i.e. to adopt the prone position. Only do so if they have not flagged any of the contraindications listed and if they are able to communicate and cooperate with you and understand when to rotate to lying on their front and how to self-adjust their position. For the setting you will be working in, most patients should be able to self-prone. However, if they are weak, they may need some facilitation from nursing staff to move in their bed. It is important to note that in patients that are non-cooperative, continue to lie their patient on their back, as lying on their front may only cause them to be more agitated and possibly short of breath. As mentioned, the flow diagram lists the absolute and relative contraindications that would prevent or make you seek assistance before deciding whether a patient should be placed on their front in the prone position. In patients that have not flagged any contraindications, it is important to explain the benefits of the prone position to the patient and their family, and ensure that they are on the oxygen therapy and that there is adequate length of oxygen tubing for them to lie on their front comfortably. They may also require pillows or rolled blankets to help support and give protection and padding to their head, chest, and hips. As the patient moves into the prone position, continue to monitor their oxygen saturation. If the saturation drops, and this is not due to a problem with the tubing or disconnection from the oxygen, wait to see if the oxygen saturations continue to drop, or hopefully increase when the patient is in the prone position. If, however, they do not increase, return the patient to the supine position, so lying on their back, and seek medical assistance. It is noted here that sedation must not be administered to facilitate proning. Please make sure this aligns with the medical input, as certain patients may have been prescribed sedation for other reasons. Once the patient has self-proned, continue to monitor the oxygen saturation levels for 15 minutes. These should remain within the oxygen saturation parameters or target range that was determined by medical staff. If the oxygen saturation does not remain within the parameters and there is a noted deteriorating oxygen saturation, ensure the oxygen is connected appropriately to the patient and then change the patient's position. This will likely mean getting them to return to lying on their back and then escalate to medical staff. Change of position every 30 minutes to 2 hours aims to achieve a prone time for as long as possible within a 24-hour period. When the patient is not prone lying on their front, aim for the patient to be sat up, ideally at about 30 to 60 degrees incline, using pillows or blankets to help achieve this position. Ensure you monitor the oxygen saturations of the patient after every positional change. If the patient's oxygen is within the target range and it is the high end of the range, consider titrating down their supplementary oxygen. Ensure they remain within the desired oxygen saturation parameters set out by medical staff. More details about weaning of oxygen should be given to you in another session. For patients who benefit from awake proning, ask the patient to change their position as follows, making sure you monitor the oxygen saturations 15 minutes after each position change to ensure their levels of oxygen in their blood have not decreased. Then continue to monitor the oxygen saturations as per the National Early Warning Scores. First, advise the patient to lie fully prone on their front, then lying on their side, followed by sitting up with the head of the bed 30 to 60 degrees if possible, or propped up by pillows and blankets. The patient should then return to lying on the other side, so if they started on their right side, advise them to then go to lying on their left. The patient should then repeat the cycle by going back to lying on their front. This advice is demonstrated in the leaflets about breathlessness that you should have already come across. The technique of rotating positions could be a lot easier for patients to tolerate rather than very prolonged periods of time in the prone position. It is also an essential way to try and prevent pressure areas and sores from forming. Despite this, it is important to note that it is the action of proning that is preventing atelectasis, so the collapse of areas of the lungs, and it is this position that is thought to work well for improving the oxygenation of the blood. There is currently no definite evidence regarding whether rotating positions or spending the full length of time completely in one position is more effective. With this in mind, it is important to remember to go with what is comfortable for the patient and what they can tolerate. Do not maintain a position that does not improve the patient's breathing nor is comfortable for the patient. Remember that each patient may tolerate each position differently, and it is important to remember that it is vital that with every patient you use the ICS flowchart to determine whether trialing the prone position is safe and will be effective. Other items to consider and think about when a patient is spending a significant length of time in one position are: inform the patient and their family. Explain the rationale for this position, the risks, the benefits, and expectations for the length of therapy and why using the prone position may be stopped, as in deterioration or no lack of comfort. Ensure you check the patient's oxygen saturation before the change of position and no more than 15 minutes after the change of position to ensure that they have not desaturated. If the oxygen saturation is stable, continue with normal observations or until the patient needs to change position again. Assess the presence and severity of restlessness or agitation. Discern whether agitation is directly related to the patient's breathlessness or hypoxia, or is a response to insufficient pain management or anxiety. If you suspect this, seek medical assistance as adjustments in opiates, sedatives, or other medication may be required. If the patient has any IV access lines, determine if the position of the line will be impacted by turning from supine to prone. Stop or limit a patient's feeding 1 hour prior to positioning in prone. If present, secure any feeding tubes before the move into the prone position. Eye care. Check no concerns prior to changing position. Oral care. Check no concerns prior to change of position. The pressure care on bony areas and skin integrity. This should be a routine evaluation for skin breakdown and also routine skin care. If skin ulceration is present, treat according to SOPs within your ITC. Some patients may need assistance in achieving a prone position. Ensure you prevent hyperextension of the neck and lower back. Also ensure that the arms of a patient are in one of the following positions: adducted, arms to the side, palms up, or with shoulders abducted, arms out at an angle with elbows flexed, or finally, one in each position. This is known as the swimmer's position. Placing pillows under the shins of the patient and their toes so their toes do not touch the mattress is also ideal as a pressure preventative measure. Monitor the patient's oxygen saturation, respiratory rate, heart rate or rhythm, and blood pressure after the movement or change of position. When it comes to the management of very severe to critical patients, it is important to monitor the oxygen saturation more closely. It is recommended that oxygen saturation is taken 5 minutes after the change of position, and if it is stable, 15 minutes after the change to ensure that they have not desaturated. If, at the 15-minute interval, the oxygen saturation is stable, Continue with hourly observations or until the patient changes position again. If, however, the patient desaturates, return the patient to a comfortable position as this may help, and, if need be, seek medical assistance. With severe to critical patients, it is important where possible to pre-oxygenate before they move to a prone position. This involves increasing their oxygen to 10 litres per minute if they are not already on this amount. Leave the patient on 10 litres of oxygen for 5 to 10 minutes prior to turning to the prone position. If their oxygen saturation is unchanged once they are in the prone position, return the oxygen level to the baseline amount the patient was on, and continue to monitor oxygen saturation as required. As previously mentioned, adopting a prone position or moving between prone and left and right side lying with short periods of sitting up is recommended for severe and critical patients, with a duration of 16 to 20 hours a day, as anything under 12 hours a day has proven to be largely ineffective in producing sustained improvements in the oxygenation of the blood. In patients that are severe to critical and very weak, you may need to assist them to lie on their stomach as much as possible, and if it is comfortable for them. With these patients, it is then recommended to reposition the patient's head at least every 2 hours from lying on the right side to lying on the left side. Always ensure you check for pressure areas and skin breakdown on the ears, nose, and around their eyes. It is also important that every 2 hours the body is repositioned slightly. This is called the slight lateral position, with minimal side-to-side changes made by placing pillows under the same side of the patient as their head is facing. This helps minimize neck twisting, and again will help alleviate pressure points and try and prevent pressure sores or skin breakdown. This is a technique that you should practice amongst yourselves before administering it to patients. This prone lying with a slight lift on either the right side if the patient's head is turned to the right, or the left side with the patient's head turned to the left, will require the use of pillows and or rolled blankets to prop up one side of the body slightly. What this means is that although the person is in the prone position for 16 to 20 hours of the day, you and the staff in the facility are helping change that position slightly every 2 hours, and you are using this time to check for pressure sores and areas of skin breakdown. If any pressure areas or skin breakdown is identified, please flag these up to your medical staff and follow the guidance for pressure care underdeveloped or adopted in your ITC. This slide is a quick reminder and checklist of what to look for with any changes of position, especially in your severe to critical patients that are less mobile and very weak as a consequence of COVID-19. You should assess skin for areas of non-blanchable redness or skin breakdown. If these are found, replace or add additional pressure-relieving dressings to these pressure points, ensuring you change the pressure friction prevention pads or dressings at least every 48 hours. When the patient is in the prone position, check the dependent ear. So, this is the ear lying on the pillow, for any compression or folding. Try to ensure that there is no fold in the ear. You may also want to consider placing foam or some sort of protection dressing on the ear as a preventative measure. It is also important when a patient is weak and not moving much for themselves to check the genitals and ensure that they are not compressed between the legs. This is specifically important in males. Ensure that a new gown or clothes are replaced on the patient regularly as part of their skincare measures. And for patients who are spending prolonged periods of time in the prone position, it may be worth considering adding padding for patients in areas such as their face, nipples or chest area, knees, prominent bony areas such as clavicles, shoulders or pelvis, anterior sides of their ankles, and their heels. It is also important to check the skin integrity in any skin folds, particularly abdominal skin folds, and in males performing Foley care if required. As well as knowing when a patient may benefit from a prone position, it is important to know when to return a patient to the supine position. Any patient that shows signs of hemodynamic instability with a mean arterial pressure of less than 60 or shows acute desaturation with an oxygen saturation of less than 88% or with over 5 minutes of hypoxemia despite increases in oxygen amounts given should be returned to the supine position. For the process of returning a patient to the supine position from a prone position, it may be beneficial again to pre-oxygenate if the patient is not already on 10 liters of oxygen. Get the patient to lead the movement, turning first onto their side, then slowly turning back to the supine position, lying on their back. Supervise the patient's oxygen saturation throughout this movement and assist the patient in their change of position if necessary. Once a patient is lying on their back, it may be necessary to cleanse the eyes with saline solution or apply any ointment to the eyes if they look irritated from lying in the prone position. Prolonged prone lying can also cause some swelling in the face. If this has occurred, apply wet gauze or pads to the face, lips and tongues, and check for any developing pressure ulcerations. If these are found, again treat according to the protocols for pressure care in your ITC. If the patient's cardiorespiratory stability allows, perform range of movement exercises to the arms and legs, getting the patient to move about the bed slightly. This may be enough to ensure joints do not get stiff and thus painful. It is important to continue to monitor the oxygen saturation as they do this. Wait approximately 30 to 60 minutes after a patient has returned to the supine position to recheck their vital signs and repeat a full assessment at approximately 4 hours to determine whether another prone positioning session is indicated, i.e., have their oxygen saturations started to desaturate again as they've laid on their back, and if the patient is unstable and fluctuating in oxygen saturations, any decisions to change position must be made by the medical lead. To summarize, awake proning of a patient can have many benefits in improving the oxygenation of their blood. However, such benefits are only sustained with prolonged periods of time in the prone position. It is important to follow the ICS flowchart and ensure that there are no contraindications for a patient to adopt the prone position and that they feel comfortable in this position. It is also important to regularly check pressure areas to prevent skin breakdown and complications that can follow should a pressure sore develop. Finally, seek medical advice with any oxygen saturation deterioration or signs of worsening symptoms or skin breakdown. By practicing these with your colleagues, you will have a better understanding of the importance of position, including where arms are placed, and ensuring comfort in areas more commonly affected by pressure. The previous slides mentioned the use of pillows or rolled blankets under the calves to lift the feet and toes, to relieve pressure areas and help prevent pressure sores from forming in areas commonly affected. There is also various positions to position your arm in when you are in prone lying. These are arms abducted by your side, as shown here, with the arms held outwards, elbows at 90 degrees, and the forearm up towards your head, palms down. Another position is arms adducted. So arms are by your side, near your trunk, palms up towards the ceiling. The photo here demonstrates the use of a dummy adopting the prone position with a head block used for head support. This is not necessary. However, here again you will see the benefits of having a pillow underneath the calves to help alleviate pressure over the front of the calf and over the toes and front of the foot. Finally, the other position mentioned for the arms is the swimmer's position, where one arm is adducted, so lying flat, down by your side, palm to the ceiling, and the other is abducted in the arm out to the side, elbow flexed, and the forearm up towards the head with the palm down. These two pictures show the position of each arm. Finally, there are two other positions to try and be sure that you are comfortable advising patients to use. Side lying, either on your left side or on your right side, and the slight lateral position. This is the position that you may use most with the very severe to critical patients, where the person is prone lying with a slight lift to one side. Here you see the lady, her arms are in the swimmer's position and her head is turned to her left and the left side of her body has been tilted up slightly using pillows and/or rolled blankets. Once you have completed the practical element and tried the various positions you will be recommending to patients and their families, it is important to go back to the Word document and check you are happy using the awake proning guidance checklists. Should you have any questions or queries regarding this session, please go directly to your ITC coordinator who can direct you to resources or put you in contact with a member of staff that was part of this training.